Mentioned earlier, it's really lovely to be here, and I'm just going to give you a sort of whistle-stop tour of the Understanding Your Baby groups. So these are groups that I offer across Wandsworth and Richmond. Has that moved on to the next slide?
Yeah.
Yeah, perfect. Okay. So so as I mentioned, I run 3 groups across Wandsworth and Richmond, and we try and run 3 sets of groups 3 times a year. So the Understanding Your Baby groups are for mothers who are experiencing low mood, depression and/or anxiety, who have an infant less than 10 months of age. And the baby attends the group with the mother. So each session of groups lasts for 8 sessions, and each session is for 2 hours. And of course, as we all experienced during the pandemic, the groups went over to a virtual platform, which was a little bit challenging in itself, but I think we've got that down to a T now, so that's really positive. So the groups are based on something called the Solihull Approach, and I've put a link in the chat to what the Solihull Approach is, to their website. I know that some of you are trained in the Solihull Approach, and I've actually delivered some of the groups with Bav and Janet in the teams, so that's been really lovely. So I'm going to sort of go over what the Solihull Approach is, you know, very briefly, but please do go on their website and have a look if you want to read a lot more about it. So the Solihull Approach was developed by a lady called Hazel Douglas, who was a child psychotherapist and clinical psychologist working in Solihull in Birmingham in the Midlands. It's a highly practical way of working with families within a robust theoretical structure, and none of the content is new or revolutionary. So I'll go through that shortly. It's an integrated psychodynamic and behavioural approach for professionals working with children and families who are affected by behavioural and emotional difficulties. It really also helps us to develop and refine our awareness of the degree to which parents or carers are sensitive and responsive to the needs and feelings of the child, how the child both initiates interactions with the parents and responds to them, and this in turn helps the parents gain greater understanding and awareness of their child. And although this may sound simple, it does have a profound effect on the development of the child. So the theoretical model has been developed from 3 concepts. So as you can see on the screen there, that's containment, reciprocity, and behaviour management. So I'll just tell you a little bit about those 3 concepts now. So Wilfred Bion first introduced the idea of containment, and he was a psychoanalyst. So containment is where a person receives and understands the emotional communication of another without being overwhelmed by it and communicates this back to the other person. This process can restore the capacity to think in the other person. In other words, the term containment is used to describe the process of one person receiving and understanding the emotional communications of the other, for example, anger, guilt, or anxiety, without being overwhelmed by them, and then being able to make sense of them and being able to communicate this back to the other person. So if as a result the other person no longer feels overwhelmed themselves, this then restores their capacity to think about the situation as well as their ability to process their emotions. So in this way, containment is a two-way process, that which contains and that which is contained. So I, as the facilitator, can provide this experience for the parents in the group, and the parents can provide it then for their baby. So, and also obviously working in a group dynamic, parents can provide this for each other as well. So why do babies need containment? So from the beginning of life within the womb, a baby is physically contained by the mother. In the earliest days, months and years of life, the infant needs the parent to replace this prenatal physical containment with a mental and emotional containment that influences the quality of the attachment relationship and ultimately allows the infant to begin to internalise the containing process and to be receptive to their own emotions. So this concept is something we introduce in the group. Okay. And I've just got some little diagrams here just to do, to try and explain what that means. So here we've got a parent, we've got their baby, and perhaps they've got a toddler as well. And perhaps things are becoming really stressful. Perhaps they're feeling low in mood, perhaps they're feeling really anxious, perhaps they're not really coping. And as you can see there, the parent's head, which is represented in red, becomes completely full up. So their ability to think about the baby's needs or the toddler's needs is then very much impaired. And then what happens in the group process, hopefully, is that I come in as the group facilitator or whoever's facilitating the group and can be that person who can contain the parents' difficulties, which then allows them to free up space in their mind to be able to think about what their baby or their toddler's needs are. So the second concept is what we call reciprocity. Okay. So reciprocity describes the sophisticated interaction between a baby and an adult where both are involved in the initiation, regulation, and termination of the interaction. Reciprocity can also be used to describe the interaction within all relationships. But from the first moments outside the womb, and perhaps even before birth, the mother and baby learn how to interact with each other. Even for something that sounds simple, like feeding, there is a kind of dance that occurs in a normal mother-child relationship. It goes something like this. So the baby signals readiness to start or stop feeding. The mother interprets the baby's communications. The mother responds. And the baby sucks and may show his or her contentment by smiling or cooing. Okay. So Brazelton, who I believe was a paediatrician, introduced the concept of reciprocal interaction as the dance of reciprocity, where, with any interaction between a mother and baby, there's an initiation phase, an orientation phase, a state of attention, acceleration, a peak of excitement in that interaction, and then it decelerates, and then eventually there's withdrawal or turning away or looking away that ends that interaction. And this is something that we do introduce in the concept of the group. And Brazelton observed 4 stages that babies have that they use to withdraw from too much stimulation from the other person or any inappropriate stimulation. So they turn or shrink away, they reject by pushing away, they decrease its power to disturb by withdrawing their attention, or they use signalling behaviour like crying or fussing to let that person know that they want the interaction to end. And then the third element is behaviour management, which is part of the ordinary process of normal development whereby parents teach their child self-control, thus enabling the child to participate in society. So parents in well-functioning families work together to place reasonable boundaries on the child's behaviour. They encourage the child with attention and other rewards. Gradually, the child becomes able to internalise both the restraints and the satisfactions for himself, and it also facilitates learning and development. So containment and reciprocity are the foundations for successful behaviour management. So you need to have those first 2 things working well before you can move on and be able to manage behaviour. So behaviour management will be more effective for a child or a young person and parent or foster parent if parental emotions are processed and their capacity to think is restored within that containing relationship. Parents are able to be part of a reciprocal relationship with their child, and behaviour management techniques are based on an understanding of meeting the needs of individual parents and their children and adapted to suit their relationships. So these concepts can be useful for us as practitioners in 3 ways. It helps parents process any emotions and anxieties that are overwhelming, which in turn both restores the parent's ability to think and enables them to help the baby or child cope with his or her emotions and anxieties. To help practitioners and parents see how the parent and child interact, This can then provide the basis for feedback in order to facilitate the relationship and to help parents work with their child's behaviour. So that's a very quick whistle-stop tour of what the Solihull Approach is and the 3 concepts within it. So what do we cover in the groups? And I know lots of you have referred into the groups, which is fantastic, but I thought it would be a good idea for me to talk about exactly what we do cover in the groups. So we help parents to think about their relationship with their baby. We explore their feelings about having a baby and becoming a parent. We look at how parents are feeling and how their baby may be feeling. So really encouraging them to start to think baby, this think baby concept that the Anna Freud Centre talk a lot about. So, what is it your baby's thinking? What is it your baby might be feeling? Getting the parent to think about that. Thinking about who can be helpful in supporting them now. I introduce and outline ways to relax and using relaxation techniques. We talk about baby's brain development and how emotional development happens as well. Parents learn how to get in tune with their baby and what that means. Understanding and responding sensitively to a baby's crying, feeding and sleeping. And that's obviously what happens a lot in those early weeks and months. Understanding a baby's development and play needs. So what should babies be doing and when, at what stage? And how should we play with our baby? We help parents to think about their own needs in relation to support for the future, so what may be helpful for them going forward. We spend some time thinking about parents experiencing being separate from their baby and how this may feel. So often some of our parents are going back to work at certain stages in their baby's first year. And also it's an opportunity for parents to reflect on what they have learnt from the group and from the process, and what they would like to develop their relationship with their baby in the future. So what is going to help them going forward? What is going to help them to cope? What is going to help them to develop their relationship with their baby further? So as I mentioned earlier, we run the groups through 8 sessions. So in session 1, we help parents to think about how they're feeling. It's all about feelings. So looking at how you as a parent are feeling and how you think maybe your baby is feeling. So we're looking at feelings experienced since becoming a mum. We do a bit of a containment activity as well. So thinking about all of your feelings and naming those feelings, who is helpful to you and how are they helpful to you, and understanding your baby's feelings. So, thinking about what baby might be feeling when they do certain behaviours as well. And also introducing this concept of containment that I mentioned earlier, of that interaction where your head might be full and therefore you don't have the space to think about your baby and what they might need. So introducing that concept as well, and introducing the concept of rupture and repair. So sometimes, there may be a rupture in your interaction with your baby if your phone goes or if someone knocks the door, and thinking about how you react to that, how you repair that with your baby when you go back to your baby. So that's what we do in session 1. So session 2, we look at understanding your baby's brain development and how your baby might be communicating with you. So we do look at the video called Brave New World. I think some of you may be familiar with that, which was a video done quite a while ago, but it's from a baby's perspective, from the moment that baby's born and what it's like from their perspective going forward. And I think that's an interesting way, to introduce the baby's viewpoint and the baby's perspective to parents. And also it sort of goes through the stages of what happens with a baby's brain and how rapidly it develops in those first 3 years, which I think can be quite surprising to a lot of the parents in the group. So we have a look at that video and reflect on how we feel about that and what we learned about that. And then thinking about how babies communicate with you and how you can respond to your baby as well. So, getting parents to think about what it is that their baby does to communicate. Are they watching? Are they waiting? Are they wondering? Just introducing those concepts. And we also have a look at the videos through the eyes of your child, which some of you may know about, which is the Kathy Burke videos where she's speaking as the baby, which is really quite interesting. But they're really good to use in the group because they're only about 3 or 4 minutes long. So that can be really good. And then we get parents to think about, between now and the next session, thinking about one way that your baby is communicating with you and how the baby, how baby will know that you're trying to understand them. What is it that you're doing back that supports your baby and contains them in terms of their communication? So session 3, we look at understanding your baby's communication just a little bit further, but in particular about crying, because a lot of parents struggle to deal with babies crying. So we're looking more in depth at that and looking at what can a baby's cry tell you. So thinking about all the different things that babies are trying to tell you when they cry. And what is it that can affect your response to babies crying? Could it be, your mood and how you're feeling? Could it be that you're sleep deprived, and thinking about how parents can respond to babies' cries. So it might be that we've got a mum with really low mood, she's feeling overwhelmed, she's not sure how to respond to her baby, but another mum in the group actually might, share with the group that this is what they do, whether it's the tiger in the tree position, whether it's going for a walk, whether it's using a baby sling, some ideas may come forward to that mum who's feeling quite low. And I think that can be really powerful within the group. So we also look at some statements about crying, such as you can spoil a baby by picking him up too much when he cries. Babies need to cry as good as it's good for their lungs. All these kind of myths that may go around, and we have a look at those as well. And then, of course, we have parents between the end of that session and the next session think about, can you start to differentiate between the different cries that your baby is doing? Do different cries mean different things? Are they communicating slightly differently with different types of cries? So that can be quite an interesting session. Then in session 4, we look at understanding your baby's rhythms and developing healthy sleep patterns. And of course, I know that sleep deprivation and wanting your baby to sleep for longer is such a huge issue, which is why it's very much part of this group, these group sessions. So we look at actually why sleep is important, particularly in relation to the baby's developing brain. We look at how long a baby should sleep, depending on their age. We talk about the issue of sleep training and what is recommended and what isn't recommended, and signposting to the BASIS online evidence-based resources as well. We look at the things that help you to get to sleep. So as a parent, what does help your sleep, and what hinders your sleep as well, and what can help your baby to get to sleep. So, what tactics are you using? What works well for your baby? And parents being able to share that in the group as well. And of course, we revisit safe sleeping. So, all of the safe sleeping advice by the Lullaby Trust, which is, extremely important, just to reiterate all those messages. And I do feel that this session does ease a lot of anxiety around sleep, and what the expectations are for your baby's sleep. I think there's a kind of Western society view that babies are meant to sleep through the night very quickly. And we kind of in this session hopefully dispel that myth and say, well, actually, in the first year of life, it really is quite normal that babies will wake quite regularly. That is normal for a baby's brain. That is normal for their sleep patterns. So that's been quite helpful. So in session 5, we look at introducing solid foods and feeding. Thinking about why we wait until around 6 months to introduce solid foods, what are the signs that your baby's ready for solid foods, and what can you do to help yourself and your baby to enjoy the whole process of introducing solid foods. I think that at this stage, this development phase can bring a lot of anxiety for a lot of parents. And of course, it's a big change again, so for mums who are anxious or have low mood, this can feel quite overwhelming. So, really in this session, We share all the information from the Start for Life weaning hubs, the First Steps nutrition information, and just gently support them to think about what they can do and how they can go about introducing solid foods. And of course, parents are able to share their tips as well. You know, we might have parents in the group who have other children, so they've been through this process before, and that might really support some of the first-time parents that are in the group, so that can be really good as well. So session 6, this is where we look at play and development. So we look at the key development stages from 0 to 12 months and what to look out for and what babies should be doing when and, you know, how, but also thinking about emotional development. So not just the physical side of development. How do babies develop in that first year emotionally? So we go into that in quite a bit of detail. And then we look at play and the importance of play and what parents can do to support their baby's play and how play really supports baby's development. And one of the key concepts in this session in terms of play is really giving parents the message that they need to allow their baby to lead the play. So it's okay to sit back and just kind of follow baby's lead, bringing in the concepts of the dance of reciprocity that we talked about earlier, that actually if baby's feeling a bit overstimulated when they're playing, they may start to look away or not be interested in a toy that you're presenting to them, and really reinforcing that view that that's not a rejection from the baby. The baby's turning away just to process everything they've learned in their brain. And I think that can be really, really helpful for parents who are kind of having lots of negative feelings about themselves, who don't feel like they're doing very well as a parent and feeling that that's a rejection from their baby, when actually teaching them it's not a rejection. It's that baby's processing a lot in their brain and they're learning. So they use that kind of withdrawal, that look away to do that. And that's not what we, that's not rejection. So that's been really helpful for some parents to know about that. Then in week 7, we look at being separate from your baby. So really thinking about the emotional impact of what it might mean to go back to work maybe, or maybe leave your baby with some family members if you want to go out or you've got to go to an appointment, those sorts of things. And we have a good in-depth look at what the pros and cons are of nurseries, childminders, employing nannies, having a family member care for your baby. And then we look at sort of the top tips for coping with being separate, and how to sort of feel like you're maintaining that bond with your baby, even though you're going to be spending some time away from them during the day. So that's a really welcome session from a lot of the parents as well. And then in the final session on week 8, we sort of review how we've come so far, how people feel about what they've learnt, how they feel about the group ending and preparing for the group ending, how they feel about their baby and their bond with their baby. Do they feel more in touch with what their baby is feeling as well? Do they understand things that their baby's communicating a lot more? And also looking at have they noticed any change in their relationship with their baby? And then thinking forward, what support is going to be useful for you going forward now the group's ending. And, a lot of the groups have been quite successful and all the parents do decide to keep in touch going forward with each other once the group's ended. So they might set up their own WhatsApp group, they might set up their own coffee morning. And then we look at questionnaires and evaluations, which I'll tell you a little bit about now. So from the groups, we're able to obtain some really good feedback, which is quantitative and qualitative. So before parents start the group, I always do a pre-group assessment on a one-to-one basis with them, where we do the Edinburgh Postnatal Depression Scale, we do the GAD-7 questionnaire, and we do the Caratane Parenting Confidence Scale as well. And at the end of the group, we repeat those questionnaires. So that gives me a really good comparison to say to that parent, you've come so far, your EPDS score has gone down, your anxiety GAD score has gone down, your Caratine confidence score has gone up. It's clear that we can see from the numbers that, you've really progressed. And that gives us a good idea how the group is working from a quantitative perspective. But then also I do an evaluation form as well and just get verbal feedback in the group session. So, you can see I've put them in speech bubbles there. We've got some feedback from some of the parents. So, you know, finding sessions on baby's brain development really helpful. How the group has actually been really containing and supportive, particularly during the pandemic, given that there's lots of other groups that were cancelled. So I think we're really proud in the health visiting team that we were able to keep this group going, you know, and to move it to a virtual platform, and how successful that's continued to go, even though it's virtual. A lot of parents found that to be quite a lifeline during the last year. And how some of the concepts, the Solihull concepts, such as the Dance of Reciprocity, rupture and repair, giving your baby a running commentary of what you're doing, how that's really sort of helped people feel like, you know, they can be more in the moment with their baby. And also bringing in, you know, thinking about baby's perspective and what baby might be feeling, you know, learning a lot about seeing things from your baby's perspective. So that's everything. So thank you so much for listening. I'm just going to try and, have I stopped sharing my